Hi, I'm here at the Brian Clay Park, located at Diamond Head on Oahu. Living in Hawaii, we're fortunate to be able to enjoy the outdoors almost all year round. We can enjoy different activities like walking, running, swimming, or exercising outdoors. Aloha and welcome to the future of senior fitness. I'm your host, Myles Diaz, Master Trainer and Certified Senior Fitness Specialist. Whether you're exercising indoors or outdoors, you should consider safety first. Safe and effective exercise is the #1 priority for everyone, especially older adults. Here are some of my exercise safety guidelines for older adults. My first and most important exercise safety guideline is check with your doctor before you begin an exercise program. According to the National Institute of Health, older adults will do just fine if they practice safe exercise by increasing physical activity to a moderate level. Your doctor will encourage you to be physically active, but depending on your health, may restrict some activities if medically necessary. Exercise safety guideline #2. Select a certified personal trainer that has experience working with older adults. I highly recommend a certified personal trainer for older adults. Why? As we age, the physical concerns increase. Every person has different strengths, weaknesses, and functional challenges. By the time we age, the decline in our abilities, health, and degenerative conditions require special attention from a professional. A trainer will teach the proper use of equipment and technique, will know first aid and CPR, and will do the proper screening, assessment, and goal setting that are very important for safety. Look for a senior fitness specialist. They will better understand how changes in age impact the function of the body systems and how these changes will affect functional mobility and independence. Exercise safety guideline #3. Check credentials. People receiving little or no specialized training can advertise themselves as senior fitness instructors. Because there is a wide range of medical conditions and functional abilities in the older population, physical activity instructors of older adults require more knowledge, skills, and experience than instructors of younger adults. Find out if your trainer has obtained a specialized senior fitness certification, has experience training older adults, and if so, how long? Exercise safety guideline #4. Always use good posture and form. Good form protects you from injury and helps you gain the most benefit from each exercise. Posture refers to the body's alignment and positioning with respect to the ever-present force of gravity. Whether we're standing, sitting, or lying down, gravity exerts a force on our joints, ligaments, and muscles. Good posture distributes the force of gravity through our body structure evenly and ensures that our body is not overstressed. Exercise safety guideline #5. Slow it down. When you're exercising, slowing down the movements and forcing yourself to be aware is of the utmost safety. Remember, there's no need to rush. Slowing it down can prevent overexertion, reduce the risk of injury, and decrease the chances of falling. Exercise safety guideline #6. If you feel pain, stop exercising. This may seem like common sense, and it is, but there are many people who still believe in the old saying, no pain, no gain. This is nonsense. Pain is your body telling you that something is wrong. Exercise safety guideline #7. Don't hold your breath during exercise. Holding your breath while exercising can potentially produce what is called the Valsalva effect. The Valsalva effect is when there's a sharp rise in blood pressure followed by a sudden drop in blood pressure. This can cause fainting or blackouts while performing an exercise. Most importantly, muscles need oxygen to function properly. A fitness professional can explain the proper way to breathe while exercising. Exercise safety guideline #8. Assess your environment. Make sure that the area you're using for fitness is lighted and uncluttered. If you have vision or hearing problems, work with a trainer or companion. Vision and hearing changes occur in the later years and affect a vast majority of adults 65 years or older. Primary changes in vision include a decrease in visual acuity, farsightedness, and changes in color perception. Let's talk about safety recommendations for people with vision issues. First, if at all possible, have equipment and instructions in large print. Second, when using upright cardiovascular training equipment, always use the emergency shutoff clips. Third, Use brightly colored tape to increase color contrast when possible. Fourth, if the exercise program involves a change in location with different light conditions, allow your eyes to adjust to the change in light before beginning new exercises. Now, for older adults with hearing difficulties. Hearing impairments can range from issues with certain frequencies of noise to the inability to hear noise at low intensities to total deafness. The effects of hearing loss may include difficulty in hearing high-pitched tones, distortions in the ability to understand human speech, a ringing or hissing in the ear, and problems hearing in a noisy environment. Here are the safety recommendations for people with hearing concerns. First, work with a trainer or companion that will face you when speaking. Second, request a trainer to speak in a slow and clear manner. Third, exercise at a time when there's minimal distraction and noise. And fourth, wear and turn on your hearing aid. Exercise safety guideline number 9. Use the right clothing and shoes. Thermoregulation is a problem during exercise due to a reduction in sweat response and poor circulation in the skin as we age. This may cause older adults to feel cold or hot more easily. Due to these changes, it's important to be aware of the signs of heat-related illness, even in controlled temperature conditions. First, check the weather conditions if working outdoors and modify the intensity of exercise accordingly. Second, always have water on hand and drink water frequently during the workout. If workouts last 90 minutes or longer, consider a sport drink replacing electrolytes. Here are the safety recommendations for clothing and footwear. First, dress in layers. This will allow you to add or remove clothing when you feel cold or warm. Second, don't wear baggy clothes that may get caught on equipment. Third, wear shoes with good shock absorption and a supportive arch and a spacious toe box. Exercise safety guideline number 10. Don't exercise if you're injured or sick. Use common sense and don't exercise when you have a cough, fever, cold, or flu. But don't let a temporary illness put a permanent stop in your exercising. Consult a physician if needed and resume your activities as soon as you can. After an illness, start your exercise program at the beginning again. Do not immediately take up where you left off. Your body needs time to recover and rebuild. For a complete list of my exercise safety guidelines for senior citizens, visit my website. I look forward to the next time. Until then, this is Myles Diaz wishing you the best in health and reminding you that health is your only wealth. Today, my featured fitness guest is Eileen Min. Eileen is a retired school teacher. She has participated in the last 8 Honolulu marathons. Earlier this year, she was featured in a Star Advertiser article titled Fitness for the Ages. Eileen is a wonderful role model for all of us. Remember, before beginning an exercise program, talk with your healthcare provider about the best activities for you. And if needed, seek a fitness professional to help you. Okay, Eileen is demonstrating a flexibility exercise for her latissimus dorsi muscle located right here, and we're using a stability ball today. You don't have to have a stability ball. You can use a chair or some other item that you can place your hand on. Okay, so she's going to lean back and get a stretch right in here for again 5 to 10 seconds. Here's an example of a balance exercise that's a little bit more advanced. So Eileen is going to do a multiplanar reach. Up, out, to the side and back. Up, out, to the side and back. Very good. Up, out, to the side and back. That's an example of a multiplanar reach. Here's one more final example of an advanced balance exercise called a step up to balance with a dumbbell curl. Great. And Eileen is going to demonstrate for us an advanced core exercise called the 5-5-5 with a stability ball on the instep of her foot. She's going to reach up here to the middle of the ball, then come over for a count of 5 to the other side, and then return with this one. That's an example of an advanced exercise called the 5-5-5. Okay, we're continuing on with advanced core exercises. Eileen is going to show us an exercise called the pass-through with a stability ball. She's going to place the ball on her instep, come down, back up, grab the ball behind her head, place it back in her instep, and back down again. Excellent job, and that's an example of a pass-through, an advanced core exercise. The next example of an advanced core exercise is called a med ball toss. So I'm going to throw this medicine ball to Eileen. She's going to come back, sit up, and then throw it back to me. This is a 4-pound ball. And that's an example of a med ball toss. Here's an example of an advanced core exercise called the V-up with a medicine ball. And Eileen's just coming up and reaching for her toes and then back down. Another example of an advanced core exercise is called the long lever crunch. Eileen has a dumbbell in one hand and coming up to the opposite leg and reaching for the toe. Eileen is going to demonstrate an advanced back exercise called a bent over row. And the reason why it's an advanced exercise is because you have to be able to get your knees in this bent position or else it won't be able to target your back. She's bringing the dumbbells right underneath her chest and then returning down. And here's an example of a bent over row for their back. Here's an example of an advanced back exercise for the lumbar region on the stability ball. Eileen is performing a back flexion extension on the ball. She's coming up and down, flexing and extending. Back flexion extension on the ball. These exercises are for our inner thighs, advanced exercises. This is called a plie sumo squat. Eileen is coming down, making sure her feet are turned out and all the way down so that she can reach the adductors or inner thighs. Sumo squat. Eileen is going to demonstrate a lateral tube walk. The reason it's advanced is because many of us have postural deviations in our lower body that don't allow us to step out straight. By using this band, we can create a strength in our lower body, our adductors and abductors, our outer thighs and inner thighs. The key to this is keeping the feet straight as we step and not dragging the back foot as we come out. This is an example of a lateral tube walk. Here's an example of an advanced chest exercise on a stability ball and also sitting up. For the core, Eileen comes up, does the chest press and also does a sit up. This is a chest press, sit up with the stability ball. Very good. Eileen is demonstrating an advanced chest exercise called an alternate chest fly. She's coming out to one side and the other side and then back. And why it's advanced is because this really challenges your balance, works your chest at the same time when alternating. Alternating chest, tubing, fly. Great job, Eileen. Now here's an advanced exercise, especially for a lady. Eileen is going to demonstrate a push-up, a regular push-up, and not one modified for women. So Eileen is going to come up and down, 2. Look at her upper body strength, 3. Eileen is going to demonstrate for us an advanced shoulder exercise by combining the shoulder press with a balanced leg up. And then she's going to bring the weights in this position and do the shoulder press. And notice she's not coming down too far, and that's because she doesn't want to put any pressure on her ligaments and joints. So this is an advanced shoulder press with balance. Aloha and welcome to the future of senior fitness. I'm your host, Myles Diaz, master trainer and certified senior fitness specialist. In my introductory episode, I mentioned that there are many misconceptions and misunderstandings about senior fitness. So today, I want to clear up some of the myths. Whether it's too little time, or not enough energy, or just hating to exercise, there is a solution. Remember, the best exercise is the one you do. Here are some of the myths. Exercise myth number 1. Trying to exercise and get healthy is pointless. Declining health as we age is inevitable. Getting older doesn't mean we will get decrepit. It's just not true. There are people in their 70s, 80s, and 90s out there running marathons and staying healthy. Many of the symptoms that we associate with old age, such as weakness and loss of balance, are actually symptoms of an activity, not age. Exercise improves more than your physical health. It can also boost memory and help prevent dementia. And it can help you maintain your independence. If you stay strong and agile as you age, you'll be more able to keep doing the things you enjoy and less likely to need help. Exercise myth number 2. Exercise isn't safe for someone my age. I don't want to fall and break a hip. Studies show that exercise can reduce your chances of a fall. Exercise builds strength, balance, and agility. Worried about osteoporosis and weak bones? One of the best ways to strengthen them is regular exercise. Exercise myth number 3. I have health problems, so I shouldn't exercise. On the contrary, if you have a chronic health problem, such as arthritis, diabetes, or heart disease, exercise is almost certainly a good idea. Check with a doctor first, but exercise will probably help. Exercise is the best medicine for many health problems. For many people, exercise can do as much, if not more good, than the 5 to 10 medications they take every day. Exercise myth number 4. I'm afraid I might have a heart attack. We've all heard about people who had heart attacks while exercise. It can happen. However, the many health benefits of exercise far exceed the risks. Again, check with your doctor before you begin an exercise program. Inactivity is actually more dangerous than being physically active. Exercise myth number 5. I never really exercised before. It's too late to make a difference in my health. It's never too late to start exercising. Studies have found that even people in their 90s starting an exercise routine can boost muscle strength. I have several clients in their 90s, and I can tell you it works for them. Other research shows that starting exercise late in life can still cut the risk of health problems such as diabetes and improve other symptoms. Exercise myth number 6. Exercise will hurt my joints. If you're in chronic pain from arthritis, exercising may seem too painful. Truth is, studies show that exercising helps with arthritis pain. One study of people over age 60 with knee arthritis found that those who exercised more had less pain and better joint function. Exercise myth number 7. I don't have time. This is a common myth in all age groups. Experts recommend a minimum of 150 minutes of aerobic exercise a week. That might sound like a lot. It's only a little over 30 minutes a day over 5 days. What's more, you don't have to do it all in one chunk. You can split it up. For instance, take a 15-minute walk in the morning and pedal on a stationary bike for 15 minutes in the evening, and you're done. Exercise myth number 8. I'm too weak to start exercising. Maybe you just recovered from an illness or surgery and are feeling too weak to walk around the block. Maybe you only get out of the chair each day to go to the bathroom. If so, start there. Decide today to get in and out of the chair 10 times. As you do it more, your strength will increase and you can set higher goals. Exercise myth number 9. I'm disabled so I can't exercise. A disability can make exercise challenging, but there is really no excuse for not doing some sort of exercise. I have clients in wheelchairs and they've made significant progress with exercising. Even people who are bedridden can find ways to exercise. A personal trainer can modify exercises to work around your disability. There are lots of ways to get fit at low or no cost. Exercise myth number 10. Gyms are for young people. It's true, the gym scene can be intimidating for older people. However, there are personal trainers who have semi-private and private studios. Many, like me, are willing to travel to your homes. Find an environment where you feel comfortable exercising. Exercise myth number 11. Exercise is boring. Find some activity that you enjoy. If exercise is boring, you're not doing it right. Exercise doesn't even have to feel like exercise. Remember that any physical activity counts. Whether it's catching up with a friend while you walk the mall, or taking a dance class, or chasing your grandchildren, bowling, raking, or gardening, it's a start. Exercise myth number 12. My physical therapist offers the same service as a personal trainer. Personal trainers and physical therapists differ mostly on who they work with. Personal trainers are involved in exercise prescription and instruction. They motivate clients with goal setting and accountability. Their training is often related to strength building, performance enhancement, or weight loss. Education on wellness and exercise and general health is part of a personal trainer's responsibility, and in the case of older adults, helping them to maintain their independence. Physical therapists usually work in a medical setting and are involved with evaluation and treatment. They help patients rehabilitate from a disability, injury, or disease, and help older adults gain back their independence. For a complete comparison of physical therapists and personal trainers, and a list of the myths about seniors and exercise, visit my website. Special thanks to Dolelo Community Media, Queens Medical Center, the American Diabetes Association of Hawaii, Kahala Senior Living Community, the National Academy of Sports Medicine, American College of Sports Medicine, and to my featured guests, Dr. Anthony Morrow, Dr. Edward Chesney, Judy Thompson, Dr. Jane Katahiro, Linda Adamson, Sally McDermott, and Eileen Min. And to the camera crew, Eric Chang, Brendan Corman, Dr. Greg Susito, and to all of the viewers who supported the project. Finally, we would like to thank the Hawaii Pacific Gerontological Society for honoring Future of Senior Fitness at their 19th Biennial Conference with the Nalima Kokua Mawaena o Makua Community Service Award. Please visit the project website to view past video episodes and to stay informed on possible future video specials.